Gentleman from Taylor.
Thank you, Mr. Speaker. Thank you, lady from Muhlenberg. Last week I filed floor amendments 2 and 3 to this bill, to Senate Bill 22, because I thought it was critical for us to increase access to quality health care, particularly in underserved areas, in order to improve the health of our fellow Kentuckians. I have withdrawn those amendments because I do not want to hurt this bill, because I think it does that also. But I do want to make a few comments, and I thank the lady from Muhlenberg for yielding to let me make a few. I filed this floor amendment because I have firsthand knowledge of the excellent care provided by nurse practitioners. I was here in the General Assembly when nurse practitioners worked for several sessions to remove the collaborative agreement for prescriptive authority for non-scheduled drugs. We were told then by some physicians that terrible things would happen if we passed that legislation. But in 2014, we passed Senate Bill 7 unanimously. And you know what? Terrible things did not happen. Senate Bill 7 increased the reach of health care to rural areas and to underserved urban areas across the Commonwealth, as more nurse practitioners were able to open their own clinics. However, the requirement for the collaborative agreement for prospective authority for controlled substances still prevents many nurse practitioners from opening a practice due to the price physicians charge for signing the agreement, or because they are not able to locate a physician who will sign. In my own county, a nurse practitioner who owns our own clinic and is one of just a few providing primary care had a physician withdraw their collaborative agreement. The nurse practitioner was told that she was competition. This nurse practitioner nearly lost her practice because of this incident, and all of her patients would have lost the primary care provider. I have a lot more comments, but I'm going to stop at that because I do support this measure. I know the lady from Muhlenberg supports nurse practitioners too. But I want to make it clear that I'll be back with many other colleagues, I think, in 2020 session to make sure that our nurse practitioners continue to have the opportunity to serve the citizens of the Commonwealth. Thank you, Mr. Speaker. Thank you, lady from Muhlenberg.
Thank you.
Lady from Muhlenberg.
My husband is a physician, and he has several collaborative agreements with nurse practitioners, and I have many constituents that are nurse practitioners. This is not anything against nurse practitioners. This is just trying to keep the piece of legislation clean so that Kentucky can join this compact. So if there aren't any questions, Mr. Speaker,